Now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Good morning, it's Tom Lucas. Welcome to Boomer Life on CIL 650, and it's time now to speak with Dr. Bobby Birdie. Dr. Bobby Birdie, hello.
How you doing?
Happy New Year. Haven't seen you for, it seems like, since last year.
It's been a long time.
Yeah, and Dr. Ron Zokol is here. Ron, good to see you.
You too, Tom.
Happy New Year.
Thank you. Same to you.
I asked you a question when you got to the studio today. I asked you about Bobby. First of all, he was behind an accident, so he'd slowed him down getting here.
Yes.
But you figure it's because he's not getting enough sleep these days.
That's probably true.
Well, I didn't say he was in the accident, but very good.
Oh.
Could possibly have been the case given the fact that he's got a change in his family condition.
So his family, since we spoke last, has grown.
I believe it has.
Tell us about your new addition.
My son was born December 18th, so we've got just over a month old at home, and needless to say, we already have a 3-year-old boy, so it's more than twice the work. You know, my wife is very busy, and bless her, she's doing everything she can because there's not lots I can do except for help out and really try to take care of my other son who, you know, with the first kid, they get a bit clingy, but lots of fun, and you know, having a kid and having a new addition to the family is absolutely amazing.
No, all the women, guys don't care, but the women like this kind of stuff. We want to know when he was born, how big was he, how much did he weigh?
Okay, so he was born December 18th at 12:30. He was just an ounce under 8 pounds.
No.
Yeah.
So that means there'd be 7 pounds, 14 ounces.
Yeah.
15 ounces. 15 ounces. 15 ounces.
Yeah.
It's on the old scale. And the other question is, has he seen a dentist yet?
He's not.
No. Well, he does. He sees one every day. So if somebody has little children in their family, when do you suggest they take them for the first visit?
You know what? As soon as they get their first tooth, it's a great idea. As soon as the first tooth comes in, it's a good idea to go see the dentist. And even if the dentist is not going to be doing much, of course, on someone that's that young, having the kid go to the dentist once a year, even if it's just to sit in the chair and ride the chair up and down and go through it, it's a great idea because that way, you know, when they actually do need something done or need their teeth cleaned or something looked at later on, it's not a traumatic thing for them. It's not something so new. They've been there before. They feel like they've you know, I'm going to my dental visit once a year already, and it works really quite well. So we've done that with my older son.
Well, I'm over 3, as you know. But I do that once a year. I go to the dentist, get in the chair, right up and down, play with all the tools there.
It's great.
It's lots of fun.
Absolutely.
So if somebody is hearing you gentlemen for the first time, it's bcperio.ca on the website.
That's right.
And we're going to talk to you folks about teeth in a day, about tooth implants, and all sorts of different things, right?
Yeah, I hope so.
I hope so. Otherwise, it's the wrong show you've come to.
Yes, we're not talking about real estate, are we?
No. Well, you were away around Christmas time getting ready for the birth of your son. Ron Zokol and I were doing the show. And our producer, Dwayne, came up to me one day after the show, as you know, Dr. Zokol. And he said to me, do you think one of the doctors would be kind enough to look at a situation I have in my mouth? What was your problem there, Dwayne?
I had a impacted wisdom tooth on the side there, so yeah.
He
So
even
that's
knows
not
the word impacted. That's
Yeah.
pretty amazing.
I'm learning here.
Horizontally impacted.
Yes.
Horizontally impacted.
Yes.
So it wasn't very nice.
It was a challenge.
It was? So you survived okay?
Yeah, survived. Went down to BC Perio there, and it's a beautiful place.
Isn't it nice?
Awesome looking place. Got a great view. Awesome staff as well. Everybody's really friendly there. It's really good.
Well, I asked you how you made out, and you said they took really good care of you down there. And I asked, did you get a chance to try the coffee? But you said no, so you're going back, right?
Yeah, I got to go back, yeah.
So that's good, because I kind of like those happy stories. You know, and we've had some of your clients call in before, some of your patients, and they told us about what a great success they've had working with you gentlemen, and it doesn't hurt, and it's great. And let's start from the beginning. Let's start the show out today. Let's pretend that nobody has ever heard of you. What do you guys do?
Ron Zokol here. What we do is handle the great majority of all issues that could make themselves available in dentistry. And sometimes what we do is evaluate where you are, listen to what your concerns are, what your desires, priorities are, identify the nature of your problem, and then determine which is the best route to follow in terms of helping you get better. It could be ourselves, it could be other professionals that we would refer you to. But the point is that we're going to find out what's ailing you, where your priorities lie, and see if we can fit a solution to.
So people come to your office, make an appointment, come to your office, they sit down in the chair, and then you sort of give them the old once-over.
That's right. We just sit down and check them out, make sure everything's doing okay, and then when something is left or right, then we discuss it. And but we do that in a very thorough manner. We make sure we use the right radiographs and the right technology, which is one thing that BC Para's got a ton of right now, for sure. And we utilize that to try to do things and make sure we provide the care that's needed. That's the biggest thing for us. And
you find out which way the people want to go with their treatments, right?
Absolutely. We
give them options?
Yeah, we give them options from actually no treatment, which is always an option, to everything from all those steps up to the best treatment. It's just a matter of giving people options, letting them know their problems and their issues, and how different ways to fix them.
Do you find you get more female clients than you do males?
This is something that we're always fielding that question.
Yeah.
And I'm not too sure. I think probably a slightly more would be my guess. I haven't checked the demographics. I don't know about you, Bobby, but the truth of the matter is that we probably have more ladies coming in as a rule, and some of those people will drag their husbands in.
Absolutely, drag is the word.
Yep.
Drag,
it happens all the time.
Because we all know that the female of the family is usually the caregiver, and most guys, I won't ask you guys because you're not like most of us guys, but we don't like going to the doctor or the dentist. So usually it's the wife or the girlfriend that'll drag us in, and we have to say that we're glad that she does. Yeah,
oh, absolutely. Absolutely. I think that a lot of times the guys let the women go to test it out. To be honest with you, I get a lot of times where all of a sudden I'm seeing someone and they think it's a good job or they're excited or happy about what treatment that's been provided for them, and then the husband show up, right? There's been one time just recently where I did some work on a gentleman, then all of a sudden his wife showed up, which was doesn't happen very often.
Interesting.
Yeah.
Now, you guys are easy to find. You've got a practice here in Vancouver.
Yep.
The address is 777 West Broadway.
That's right.
Okay, suite number 501. And that's right at Willow Street, right?
Yep, that's Broadway and Willow. Yep.
And the other location is where?
In Coquitlam. It's 1175 Johnson Street, right next to the Coquitlam Center, right where that new SkyTrain is going to go through.
Oh, right on Glen Drive there.
That's right.
So conveniently located.
Absolutely.
And we have telephone numbers for each location. If you want to make an appointment with one of the great doctors over in the Coquitlam location, it's 604-936, 604-936-8244.
That's right.
Right? 604-936-8244. Or in Vancouver, 604-872-0222, 604-872-0222. And it's the BC Periodontal Health and Implant Center. We've talked before about teeth in a day. Tell us about teeth in a day.
Teeth in a day is where you come in, have an implant placed, and a tooth put on at the very same day. Now, it might be one tooth or it might be a whole set of teeth.
In a day.
Yep.
In one day.
So I can go into your office looking like a pirate and come out looking like a movie star.
You know what? It's for maybe not those kinds of words, but I would say that it happens quite a bit. People come in with teeth that are not doing so well, and they know they need the overhaul, and we do it. Yeah. And it happens in one day.
And you have to supply your own eye patch.
Do you really? Well, it's the new year. People make resolutions for New Year's. Did you guys make any resolutions, doctors?
Yeah, I'll get more sleep.
Lots of. Well, you should have thought about that 9 months ago.
I know.
Maybe you should have had more sleep 9 months. That's some other doctors. We won't get into that right now. And Ron, how about you? Did you make any New Year's resolutions?
None at all.
All right. No, either did I, because that way I can't break them. Right? But there might be some people out there who might be thinking about their teeth, and they should make some New Year's resolutions. So now would be a good time to maybe pay you a visit.
I think there's a great opportunity here for people who are trying to make some adjustments in their life. There's far too many people, and they realize that they haven't been as prudent as they could have been. We don't judge on that level, but here's an opportunity where you can come in and set a new standard of health in your dental care. We'll help you do that.
And we haven't said this yet on the show today, but consultations cost how much?
Nada.
Free.
It's complimentary consultation.
Gratis.
Yeah. That's the best part about it, right? So
even
if you're thinking about it or wondering, it's a no-risk complimentary consultation. Just come in and get your information. That's the biggest reason why we do it, is so people can come in and get the info they need. And whether or not they act on that information right away is really not the reason why we're having them come in. We want to make sure that they get the information.
Well, Dr. Bobby Birdie and Dr. Ron Zokol are with us till the top of the hour today. And if you have any dental questions and you want to talk to the good doctors, our telephone number is 604-280-0650, 604-280-0650. If you live out of the local dialing area, it's a toll-free call. It's 1-877-280-0650. That's toll-free, 1-877-280-0650. I'm Tom Lucas. You're listening to Dr. Bobby Birdie and Dr. Ron Zokol on Boomer Life.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at ShannonOaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
CL 650. Doctor, give me the news. I got a bad case of loving you. No pills gonna cure my ill. I got a bad case of loving you.
You're listening to Boomer Life on CL 650, smooth and easy. Good morning, I'm Tom Lucas. We're speaking with Dr. Bobby Birdie and Dr. Ron Zokol, the BC Perio Dental Health and Implant Center. Welcome to the show. Nice to see you again.
Thank you so much.
Congratulations on the birth of your new child.
Thank you so much.
Going to be a dentist?
I'm hoping. We'll see.
Either that or a stevedore or something like that. People hear us talking to you gentlemen on the radio each and every month. We talk about dentures, we talk about implants, we talk about dental health. So let me ask you a personal question. Maybe give us your background. How did you get involved with this, and what's all the background, the studying you did? And oh my God, it goes on and on.
Okay, so what I did is I went to, I'm originally from Alberta, so I was born and raised in Edmonton. Then I went to my undergrad there. Then I moved to Saskatchewan, went to 4 years of dental school in Saskatchewan. Then went to Minnesota, and I did 2 3-year residencies in Minnesota to become a dual specialist. And then moved back to Vancouver, and voila, I'm here.
So did you become a dentist because the Edmonton Eskimos wanted nothing to do with you?
I tried hard. I got redshirted about 3 times.
Did you really?
No,
seriously, this guy is big enough to be a football player.
No. Didn't have that happen. But I used to competitive bodybuild, so that's why I'm as big as I am, I guess. But I should probably eat less right now, but not so bad. But no, it's been good. Alberta was a great place to live. I still practice there. Just actually was there yesterday, so. Just fly back and try to help out and see my folks once in a while. So
just flew back to be on the show with us, Ron. Isn't that nice?
That's right.
And our other guest on the show is Dr. Ron Zokol. You've been around Vancouver for a long time, and you were telling me a long time ago that your dad was also a dentist.
He was. I spent my first 20 years in practice along with him. That was fantastic.
It's kind of cool.
Yeah, I mean, he was a specialist. He was a prosthodontist. And although I never took a specialty myself, I became involved in a field that doesn't have a specialty, and that's oral implantology, which involves a number of specialty level services. But after 40 years in practice, I'm very, very proud to say that I'm part of this BC Perio team.
And when you're not helping patients out, you're out there and you're teaching.
Lots and lots of that,
Yeah.
and that comes in 2 forms. One, both Bobby and I are involved in the Pacific Implant Institute. This is a 20-year program that's been teaching dentists from around the world to learn how to do oral implantology at all levels and to help them become credentialed and skilled so they can take that knowledge back and train other people in their areas. So that's the educational. The other part is lecturing all over the country and other countries from time to time, and spreading the wealth of knowledge that we've had the privilege to accumulate.
And sometimes I hear you even teach aboard ships and go places.
Oh.
He doesn't. He tries not to do that because he feels like he's taking advantage. That's all it
You
is.
see, I'm trying to hook up with him for the next trip.
The Bahamas cruise is next, right?
Bahamas cruise, yeah.
Actually, I'm scheduled to lecture on a Southeast Asian cruise from Hong Kong to Singapore.
I think you could use yourself an offstage announcer. I could do that for you.
If you can fit into my bags, that might work.
I can
just
fit
fine.
into your bags. I'm not as big as you guys. So your locations, two of them again, 777 West Broadway, Broadway at Willow in Vancouver, and the other location is on Johnson Street, 1175 Johnson at Glen Drive in Coquitlam. So if you live in those areas and you want to stop by and make an appointment and have the doctors look at you, please give them a call. In Coquitlam, 604-936-8244, 604-936-8244 in Coquitlam. And in Vancouver, it's 604-872-0222, 604-872-0222. A lot of people will say, well, listen, my grandma, God love her, had some plastic teeth in her faces for years. And that was good enough. And maybe it was for her. But these are the 2000s now, and false teeth can be something like they move around. Sometimes they're not comfortable, right? So you have an alternative to that.
We have a number of alternatives to that. I think, I don't think that dentures or false teeth or plastic teeth, whatever you want to call them, I don't think that there's a lot of, I don't argue with the fact that they still do work for some people, and for some people they're a good solution. The thing about it is most times if there were means or if there was a lack of fear, I think most people would not do dentures and they would do something else, whether it be implant and retained dentures where dentures kind of are fixed onto implants where they stay in much better, or implant bridges. Dental implants have really revolutionized how we do dentistry and really allow us to do so much more.
You have, I would imagine, a fair amount of people that come to you that are in pain.
Yes.
As a matter of fact, Ron, we had a gentleman call in one day on the show, and he was talking about pain, and you said the most important thing is take care of the pain first.
Oh, absolutely. People can't think straight. When you and I are in pain, the first thing we want to do is get out of pain. And sometimes we jump to an end conclusion is get rid of the whole system. Let's throw the baby out with the bath water. If we get rid of the pain, that suits me fine. Until the pain's gone and you say, oh my heavens, why did I go that route? What we want to do is get rid of the pain so you don't have to make that huge mistake of throwing the baby out with the bath water.
A lot of people, too, they come to you obviously because they have problems in their mouth, dental problems, but not just teeth. You're not just promoting teeth. You're promoting a healthier, happier lifestyle, too.
It's quality of life.
Yeah.
Really what it comes down to. And that brings in so many factors, not just your dental health, but your priorities, your financial ability, the whole works. We want to make it work for you. That's our goal.
And I think one of the things that our clinics is set apart was some of the technology that we have and the means that we have. I had a gentleman come in who heard us on the radio here just last week, came in and said, I've been here, I've been there, and they said it's going to take this long or this can't be done. And because of the imaging, because of the amount of experience we have of doing these types of procedures all the time, I'm sure we'll be able to do it. We'll be able to do it and do it in one day. You know what I mean? So
it's it boggles my mind when I hear you guys talk like this, but it's so true.
Yeah, it's amazing. And there's numerous times we had another patient just actually late last year, and same idea. She'd been to lots of places, and they'd said 2 years. Oh, you're gonna have to take bone from your graft from your hip. You have to go to the hospital to get this done. And I said, well, let's do it in one day, and we did that in one day. She's got a fixed set of teeth in her upper arch, and it was done in one day.
And the amazing thing is you do it all at your own office.
That's right, all in one place. At either location. It's pretty amazing, and it's a lot of fun to be able to provide these types of services because you really do help people's lifestyles and the way they live their life, because people don't like coming to the dentist in general, and they're not there to they don't come in saying I want implants. They want teeth. They want teeth so they can chew and smile and talk, and that's what we provide. Absolutely.
I'm one of those weird guys. I would rather go to the dentist than go to the regular doctor. If you know what I'm saying? My doctor goes, "You're who? Have I seen you before?" Dentist knows me, but the other guys. It's because I told my dentist, I said, I like you. And he says, why? I says, because I know you are a doctor, but I don't consider you to be a doctor, if you know what I mean.
Absolutely.
Like when I walk in to see him, he's not snapping on the rubber glove and asking me to grab my ankles.
The one glove is key there, I think.
Right. Got 2 gloves on, it's not a problem.
It's not a problem, it's 2 gloves.
We mentioned the birth of your brand new baby boy, and we said that, as soon as the youngster is old enough, at least take him to the dentist, get him to sit in the chair, him or her, so they can get desensitized. What about older folks? How, baby boomers and up, should they go too?
Absolutely. Even when people have implants, we still have them come and get their teeth cleaned every 3 or 4 months, get their implants cleaned if you want to call it, and they need to see a dentist. They need to look at things. So everyone of every age group should be seeing the dentist at least once a year for a checkup, because a lot of times the things and the symptoms that are involved, just you can't tell. You don't realize until it's too late almost. Mm-hmm. So it's worth it.
And Dr. Ron Zokol, you were saying that you've had some older folks come in too because they're looking for a new partner. Well, I just made that part up myself.
Not within the dental office, I trust.
No. Well, whatever. Que sera, sera.
But they want to look better.
Yeah.
They want to look more youthful, and of course that's what goes hand in hand and part and parcel with doing getting your teeth fixed properly. It gives you a more youthful appearance. Mm-hmm. Makes you feel good about yourself. So it's not only a physical health improvement, it's emotional and mental health improvement as well. So when you referred to this person who comes in who's in an old age home literally and wants all his teeth redone, and he's in his early 90s. Now, this is a very youthful 90 for sure, well, yeah. But the principle still holds. I mean, this guy, he never had a moment. One of the things that happens with older people is the nerves in their teeth, the pulp, it recedes a bit. Dental treatment, basic dental treatment, is virtually painless for these people. And he had all his teeth done. His son was retired, and he had to get his son's approval. His son was in his 70s. And he got his retired son's approval to go ahead with this, and he had his teeth done. And this guy, he was enjoying the ladies in his retirement home, and what a lot of fun this gentleman was. He was a character, but the life change was dramatic for him.
I'll bet.
And I think the days of, I'm over a certain age, that's it, I might as well just, stop looking after this, stop looking after that, stop spending money on this or that. I'll be honest with you, I think those days are long gone. Those days are long gone. I have a lot of patients that come in that are over the age of 70 that are just vibrant and full of life, and they want to look good, they want to feel good, they want to they want to be able to chew whatever they want, and they should be able to do that, absolutely.
Well, like you said, they can chew whatever they want. I mean, you still have to eat.
Yeah.
And your teeth help you eat.
Absolutely.
And they help you eat healthy.
They do too.
That's what it does.
That's what it's all about. So if somebody would like to make an appointment with you, I guess it's an easy procedure. Just call your office, Vancouver or Coquitlam.
That's correct.
They'll either see you, Dr. Birdie, or a couple of the other dentists that are there.
Yeah.
Come on down. Consultation is free.
Mm-hmm.
Free is good. That's not a CT you take at the pictures. It is a CT scan.
Yeah. CT scan.
And that has less mercury than regular
filler. It has no mercury at all.
No. What is it? The
radiation.
Radiation. Sorry.
Yeah.
The mercury's in the fillings, right?
Well, very, very low. See, characteristically, CT scans, particularly medical CT scans, have to go through a lot of tissue and be able to differentiate that tissue. The power required and the X-ray required is much greater. This technology that Bobby put into the office of BC Perio is phenomenally low. It's the lowest radiation source for anything of this, and it gives us three-dimensional imaging of what's going on in your jaw structure. That is the salient difference.
I love this machine. Every week at the machine and the imaging, because you can see something in 3 dimensions. It solves problems or answers questions you normally couldn't answer on just a 2D image, and it's the lowest radiation in the world. And I don't mean that by a joke. That's the absolute truth. And it's done in 4.8 seconds. There's less radiation than a normal diagonal X-ray.
So like you were saying, you can see so much more than a person that just has a regular X-ray.
Absolutely. Yeah. Absolutely. Yeah, so much more. You'll be able to see your entire jaw, bone structure, teeth, everything in 3 dimensions. Like it's amazing. You'll actually be able to, on the computer in 3 dimensions, we can spin someone's mouth and face right around, look at everything. It's amazing. It's amazing.
Now the patient stays stationary. Everything moves around.
It's not one
patient moving around the equipment.
We don't have a remote control, but it's pretty good. It's pretty good.
And you did this with Dwayne, did you?
Yes.
Yeah.
Absolutely.
So he can't say anything right now. Tell me, how did his mouth look? Is it okay?
Oh,
Other than that one tooth?
Phenomenal.
Yeah. You got a good mouth there, buddy. It's okay.
Excellent.
Keep your career in radio going. So if you'd like to get in touch with our doctors, here's the phone numbers to call. In Vancouver, 604-872-0222, 604-872-0222. If you live out in the Coquitlam area and you'd like to drop by and pay a visit, their telephone number is 604-936-8244, 604-936-8244. Your website?
bcperio.ca.
Now, if I go there, what am I going to find?
Oh, a lot of photos, lots of videos of different procedures, all the information about the doctors. You can even book a consultation online.
Really?
Yeah, there's everything that you would need in terms of information. And if there's something you don't need or something that you do need that's more, call us.
So if I'm thinking about maybe do I need implants or do I not need implants, if I go to your website, I at least get some sort of idea, right?
Absolutely.
Fantastic.
It'll give you some directions and possibilities that are there. But ultimately, everybody needs a very specific personal evaluation because everybody's different.
Mm-hmm. Yeah, that's so true. Everybody's different. Remember my mom telling me that. Everybody's different. Now I finally know what she meant. You're listening to Boomer Life on CL 650. It's smooth and easy, and we're talking to Dr. Ron Zokol and Dr. Bobby Birdie from the BC Perio Dental Health and Implant Center, right?
That's it.
And we're going to be here till noon? Mm-hmm. All right, well, let's come back to the show right after this.
It's all about the baby boomer lifestyle. Boomer Life on CL 650.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
CL 650. Gray skies are gonna clear up. Put on a happy face. Brush off the clouds and cheer up. Put on a happy face. Take off the gloomy mask of tragedy. It's not your style. You'll look so good that you'll be glad you decided to smile.
Yes, it's Boomer Life on CL 650, smooth and easy, and we're speaking with Dr. Ron Zolko and Dr. Bobby Birdie. You know, I went to your office one day, I didn't tell you this, and I hung out by the elevator, and I saw some people going into your office, and they looked miserable. But they came out just like that song. They had a happy face. You're performing magic in there.
Daily.
Yeah, you do this all the time. So tell me, what are some of the, I guess, benefits of having implants?
Wow. We don't have that much time.
Well, take all the time you need. Take all the time you need.
Fundamentally, it's a return to as close to your natural dentition as you could possibly get without having the risk of decay, nerves, abscesses, things like that from happening. It's an ability to return to your ability to eat properly, eat the type of foods that keep you healthy. It also is a psychological factor so that your social life and even your business life, if you're still in business, will improve because people are attracted to people who look good and feel good and have a great disposition.
You know, a lot of times the families will get together. There'll be grandma, granddad, and the grandchildren, and mom and dad, and you might see grandma or grandpa smiling about with their hands in front of their face. Right? Oh, hi. And that's because they're self-conscious about their teeth.
Oh, absolutely.
So by visiting you gentlemen at BC Perio, they can sort of change that lifestyle.
Yeah, absolutely. I think we're able to definitely make them look better, definitely make things function better. We can give them back, depending on what kind of treatment they want, give them back what they had when they had all their teeth and that were normal and healthy and young, almost every time. There aren't too many people that we cannot treat. So whether it be different types of modalities or whatever we got to do to make it happen, we can do that. And I think one of the biggest things that at least a lot of women worry about, and men too, but is bone structure. And they worry about, are my bones withering? Do I have osteoporosis? Those types of things. Well, to me, that's probably the single biggest benefit of a dental implant is that because it stimulates your bone to stick around. And because it stimulates your bone to remodel and stick around, it does what a tooth would do. Because the reason why people's mouths and bone withers away in their mouth over time, especially it happens exponentially more when they lose a tooth. So if you lose a tooth, and especially if you lose all your teeth, the bone that's around there's nothing stimulating that bone to stay.
Yeah, I was going to say too, if maybe over their lifespan somebody's lost a tooth or had a tooth taken out and they haven't had it replaced, that their face is going to change.
It's possible, yeah. It's possible depending how many teeth they've lost and where they are, especially in the front. If they, there's people that have lost a whole bunch of front teeth, and yeah, you'll see as soon as they take out their partial denture, the lip will start to be pushed in a bit more, and they lose that support. Well, that's because of bone loss.
What are some of the biggest questions, Dr. Ron, when people come to see you? They meet you, hello, nice to meet you, tell me about yourself. Then what's next on their mind? What sort of questions are they asking you when they come to your office?
How much is it going to cost, and does it hurt?
That's two good questions.
Yeah, those are the biggest ones. And cost is always a factor, and we have ways at BC Perio will help mitigate that expense, and on several levels. Both, I think the costs factor that we charge is incredibly good considering the level of expertise that one is getting. Additionally, there are opportunities when we can, particularly people, that we can somehow disperse the costs over a period of time of treatment rather than have it all up front. There's lots of ways that we can help people.
So it's you make it easy for people.
As best possible.
We try to make sure that they get all the information they need. There isn't a lot of ambiguity, and they know all the steps. Because I think that's another thing too. People want to know how many appointments, how long is it going to take. Yeah. That's another one that really people want to know. And to be honest with you, I think that's something that in our office we are really good at, because just with the experience, the expertise, and the technology, we'll be able to provide treatment. We can do things that would take other people many months or years, and we do it in a day. That's really kind of, I don't know. I think it says everything right there. It's pretty amazing to be able to do that in one day.
So after the initial free consultation, I'll stress that again, free consultation, you can tell them exactly what the plan would be, how you're going to lay things out, how you're going to do it, what it'll cost. Let's get started, and here's how long it's going to take, right?
Yeah, those are the main questions, and they get answered at that first consult, absolutely, most times.
Or on the other hand, like you said too, like you say, well, there's nothing to be done.
Yep.
In some cases, we see that. Yeah. We have people knocking on the door who are sometimes they're there just to find out whether we're being truthful, with no intent of following through, and that's okay.
That's okay.
Don't mind that.
Yeah.
Then there are people who are looking for, don't have any means whatsoever. We'll still help them, and then there are people who really find the point that this is all about, and they have incredibly difficult or complex situations, and we are a facility which can take care of it.
All right, let's look at it. You mentioned from basic to to extensive. So let's start off with a basic sort of situation. What would be something basic somebody would come to see you about?
Missing one tooth, or they've got a tooth that's broken, or maybe they've got some periodontal disease. I think initially that's kind of something that would be basic. I think maybe they've got a denture that they would just want their denture to fit a bit better. Those types of things I think would be kind of more basic, I would say.
And Dr. Zokol, to the other end of the spectrum?
There's two directions it goes. One where you've got no teeth at all, and the other is that situation which is harder to pick out, and that's where every time you go see your dentist, something more is being done. It seems like you're throwing lots and lots of money into your dental health, but you're not getting any stability over a long period of time. And it feels like you're on a slide downhill and there's no stopping it. It's like a snowball effect. Those are people who are not being treated comprehensively enough to stabilize them. And that's where we can really help them.
Often people will go to the regular dentist, and God love them, they're doing the best they can, but sometimes people do make mistakes, and you will take care of that.
And I don't want to term it as mistakes. I think they do the best they can. These are very good-minded people. But you have in this facility here at BC Perio probably some of the highest credentialed individuals in North America to take on just about any situation, and probably people with massive decades and decades of experience on top of it. So between that training level, expertise, and experience, there's very few things that we can't handle.
We haven't mentioned the other dentists that work with you, and maybe we should, so they don't get their gums out of joint.
Sure. We've got 3 other specialists that work in the office, and actually Dr. Tim Gould, who just recently retired. We miss him a lot already. He was a periodontist, and he's still active in the dental community as well with the association. And then we have Dr. Peter Munz, who's a periodontist. He's got over 40 years over as a periodontist in the Lower Mainland, and God bless him, his great work. And then Dr. Josh Kleiman, same thing, many years, over 30 years of experience. He's been a periodontist in the Lower Mainland as well, and he's got a great following.
And another good thing about your clinic as well, people come through the front door, they go out the elevator, they go down the hall a little bit, they come through the front door, and they're shaking inside. They don't know what the hell's going to go on here. And they meet the people at the front desk. Right from the front desk, people start taking good care of you. They're friendly down there, and they're...
Yeah. The office was built when I designed it. I wanted it to be so when you walked in, you're just like, oh, okay, this is not so bad. Because when you walk in, the first thing you're going to see is a view. And the view is that skyline, Vancouver City skyline view. It's a beautiful view, and it really helps to bring the stress of things down, I think, quite a bit. And, my staff, I've got great staff. I can't say enough about them. They're great, and they all want to make sure that your experience when you come in is something that is very comfortable and is very stress-free.
Well, by the time your assistant takes the patient down to your chair for you to do your magic, they're pretty well calm.
Mm-hmm.
That's nice. And yours is probably the only clinic I've seen where you have to lay on your back to watch TV.
Yeah, there's a TV above each chair. So
there's a TV there.
You can listen with wireless headphones and watch some TV. You know what? It's one of those things where I put it in, and I every single time I see someone using it, I'm so excited because I'm like, oh, someone's using something I put in. It's great.
Maybe what we should do is get them a copy of this program, and they can listen to you guys while you're doing your work. Yes, we're speaking with Dr. Bobby Birdie and Dr. Ron Zokol. They are gentlemen that are involved with the BC Perio Dental Health and Implant Center in Vancouver. The address is 777 West Broadway. That's 501. And right at Willow Street, their telephone number 604-872-0222. If you live in Coquitlam, it's 1175 Johnston Street. That's Johnson Street, Unit 250. It's right at Glen Drive. And the telephone number for the Coquitlam office is 604-936-8244. We have maybe about 20 minutes left on the show this morning. And if you have any questions or concerns and you want to get free is the word, free advice, friends, you can give us a call, 604-280-0650, 604-280-0650. If you live out of the local dialing area, it's a long-distance call. The doctors are happy to pay for it. You didn't know that, did you?
It's on us.
Yeah, it's on you. 1-877-280-0650, 1-877-280-0650. You're listening to Boomer Life on Smooth and Easy CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at ShannonOaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
CIL 650. After breakfast, lunch, and dinner each day, brush all that food away. Listen what your mama say. Gotta fight tooth decay. Brush them till they're clean and bright. Brush them till they're pearly white. Morning, noon, and night. And then smile, smile, smile.
Yeah, smile, smile, smile. I played that for you, Dr. Birdie, to play for your little baby.
Sounds great.
That's good?
Yeah,
I'll get you a copy of that, and you
I'd love that.
go home and play it to him over and over and over again. We are speaking with Dr. Bobby Birdie and Dr. Ron Zokol from BC Perio Dental and Health Implant Center. Let me ask you a question. I didn't know about this, but what the heck is PRF? What is that?
It's called platelet-rich fibrin.
All right, now for us people who know nothing about dentistry, what does that mean?
Okay. The blood cell, all the blood in your body is comprised of a combination of different things: plasma, red blood cells, and white blood cells. And within the white blood cell structure, you have these things called platelets. They're part of the rebuilding structure. So when something actually gets damaged in a blood vessel or skin and you start to bleed, it's the accumulation of the platelets and the development of the fibrin which creates the clot. And the platelets contain all these growth factors to help regenerate the natural tissue again. What we do is we harvest that. We actually take blood out of your system, take some vials of blood, and we spin it down, and the platelets that we get from your blood go back in, help heal the tissues that we are working on. So there is a dramatic improvement in the ability to rebuild bone structure, soft tissue, reduce complications in surgery. This is something which has really, really turned, and we're getting a lot more dentists all throughout the world who are starting to use this material. We've been using it. I've been using it for over 20 years.
Wow.
So this is before somebody understood it was called platelet-rich fibrin, truly. But the improvement in surgical results is very, very dramatic. And Bobby will talk a little bit about something else we're doing, which is really unique.
Yeah, you guys are involved with some great research going on.
We are. I'm just going to boil down PRF quickly just so it's a bit simpler, just because I think Ron is a really smart man and he talks about it really well. But basically what we do is we spin down your own blood and it ends up coming out into different layers, and we take one layer of it that's white and it's more of a rubbery material, and we're able to put that into the surgical site, and it really helps to rejuvenate the area and make sure that things heal much better.
So you're using my own...
Exactly.
Yeah, wow.
So if something's going wrong in your mouth and we're doing something, well, guess what? We use your own body to make it better, and that's the best part about it. So, and we're lucky to be part of a research study right now where we're involved in deciding how the quality of your platelets relates to kind of what we're going to get from a situation in PRF, and also surgical results and other types of results. So we've partnered with a company that's doing that, and they're also conducting research in conjunction with UBC as well. And our office, we're blessed to be able to be a testing center for a lot of things, whether it be new implant systems or new cutting edge things. A lot of times we're getting things ahead of everybody else just to try out and to utilize and be that testing center for some time. So that's pretty amazing.
What I like about you guys is that you're willing to share.
Well, yeah.
Yeah.
That's I think that's why we're so successful in our educational programs, and that is we don't limit what we give to other people in terms of allow them to go ahead and learn how to do these things.
Mm-hmm. I've been to your office a few times, as you know, and every time I go down there's a dentist from Edmonton, Alberta, Saudi Arabia, somewhere.
That's right.
But that's what it is. Our doors open to all dentists everywhere all the time, so they want to come and observe. They want to come and take a look at what we're doing. The door's always open. We have dentists coming through our office to observe or to be part of either a course we're teaching or something else every week. Every week it happens.
Now, here's one thing we have not touched on this morning. If I go to my regular dentist, Dr. Bob, and do I need to get a referral from Dr. Bob to come and see one of you gentlemen?
No, you do not.
I don't.
No, you do not. We welcome anybody, and we welcome those people who would just like a second opinion.
Mm-hmm.
So if if you're concerned at all, come get a second opinion. And if the dentist you're treating you is doing a great job, we're going to say, go back. He's doing a great job for you. All is well.
It's important to know that's a big difference compared to medicine, where you need a referral to go see the specialist. It's you don't need one to come see us. But that being said, we will work with your general dentist a tremendous amount, and we'd love for them to refer to us, and then we could work together and help just treat you overall together.
Let's suppose that somebody does not have a regular dentist. What would give them an indication that they should maybe be calling you?
If they haven't seen a dentist for a while,
that's a good indication right there.
Yeah, that's the perfect indication. Any kind of pain or any kind of other symptoms they're having. Those are any teeth that they think are moving, anything that's sharp in the mouth, and those types of symptoms for sure. That should give us a call. Come on in, and if they end up being our patients that remain in our clinic, that's one thing. Otherwise, we will do our very best to find them a dentist in their area or someone that will work well with them.
That's correct.
Yeah. So it's pretty darn easy.
It ought to be.
Well, makes a lot of sense.
Pick up the phone, give us a call. That's
all right. Well, I'll pick up the phone. And here's the number I would call in Vancouver. See, I can take a hint. 604-872-0222. That's the Vancouver office. 604-872-0222. If you live out in the Coquitlam area and you'd like to make an appointment, have one of the good doctors take a look in your mouth, their telephone number in Coquitlam, 604-936-8244. 604-936-8244. The address in Coquitlam is number 250, 1175 Johnson Street, right at the corner of Glen Drive. And in Vancouver, it's easy to find. You can go shopping, go have something to eat right after. 777 West Broadway at Willow.
That's right.
Lots of free parking.
There is.
Well, there's lots of parking. But you're in and out like a dirty shirt.
I feel like I'm your straight man.
That's
really
okay.
Yeah.
Well, you want during the break, you asked me if I ever considered doing stand-up comedy, and maybe what I could do is maybe start at your office. What do you think?
Listen, I'll keep the office open late for that.
Would you?
No
Thank
problem.
You. That's good. Well, now I have a venue. I just get some material together. So you obviously enjoy making people's lifestyles a whole lot better.
You know what? I love what I do. There's no. If I had to do it all over again, it's exactly what I do in exactly the same way. It's a lot of fun, and it's fun being able to provide services at a highest level that you possibly could, and doing the very best and being challenged, and also the best part about it is people's reactions and how they feel afterwards. That's what it's all about.
Ron, how did you two guys get together?
I got a phone call, actually. We were put together, actually, by a colleague in the field. Bobby was looking for a solution in Vancouver. We sat down for a cup of coffee. We talked. Our goals were very similar. He seemed like a pretty good guy, and so we started to move and direct our solution towards working together. And down the road, here we are.
Now, your practice, Dr. Ron, was originally on Cambie Street?
It was on 12th Avenue.
12th Avenue
Cambie.
In Cambie,
Yes.
and now you're over on Broadway.
Yeah, about 4 blocks away.
Yeah. So your regular patients know where to find you now.
They sure do.
That's good stuff. All right. We got one more segment in the program to go, and it's a delight. I love talking to these gentlemen, Dr. Bobby Birdie and Dr. Ron Zokol from the BC Perio Dental Health and Implant Center, and you're listening to Boomer Life on CL 650, smooth and easy.
It's all about the baby boomer lifestyle. Boomer Life on CL 650.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
CIL 650.
Keep smiling. Keep smiling. Keep smiling. Keep smiling. Keep smiling. Keep smiling. Keep smiling.
That's what the show's all about. We've got a way to keep you smiling. Keep smiling. That's what life's all about. Be happy. And you, gentlemen, make it so people have a happy life.
That's what we do.
Now, Ron, if you want to have a happy life before you go home, there's somebody special you need to say hello to this morning.
Oh, I got to shout out to my wife.
Why is that? Other than you love her?
I do, and it's her 60th birthday.
No kidding.
Today. And she's going to hate me for saying that to her. But the fact that she looks about 45, maybe 44.
Really? Really? Wow.
This is fantastic. Anyway, so just a shout out to her and say, happy birthday, dear. I love you.
That's a nice thing. And my wife is having a birthday coming up on Tuesday.
Wow.
Yeah.
Okay.
Oh, pretty darn good.
This is a coincidence.
You remember how you met your wife?
Oh, I do.
Don't tell me she was a patient.
No. No. That's a long story.
I see. See, he's not going to tell us.
No.
That's okay. That's understandable. So now people want to make a consultation to go down and see either of you gentlemen, Dr. Bobby Birdie or Dr. Ron Zokol. The consultation is free.
Yes.
And I can't stress that enough because people start to cringe. As soon as I walk through the dentist door, the meter starts running. But in your case, that is not the story.
That's not the story.
So I come in, I have a cup of coffee, I talk to the nice people at the front desk. They take me through the glass doors. I go down the hall. Then what happens?
You sit down, we have a chat, we take a look, and then sometimes we get a scan on you and we learn about all the things you need to learn about.
Like what?
Well, like the issues, if there are any, how often you should be seeing the dentist, if you do need work done, what that work is, different options that are available to you, how long it'll take, how much it'll cost, and answer any and all the questions that you may have.
And, of course, it's totally painless. And you can guarantee that. No, they can.
Hey, listen, I can guarantee that a talk is going to be painless, right? So,
yeah. Let me just say, Dwayne, when you went to see Dr. Zokol, was it painless?
Yeah, I was pretty good. I was awake. I wasn't knocked out for that one, and it was very unpainful, I'd say.
Unpainful. I've never heard that expression before, but that's good.
Hopefully you'll hear more and more of it.
I'm thinking so. So from youngsters all the way up to oldsters, go and see Dr. Bobby Birdie and Dr. Ron Zokol because you can take care of them, right?
We can.
Yeah.
And we talk about teeth in a day. We talk about implants. We talk about dentures. We compare the rest. We talk about dental health. So the important thing is dental health is one thing. Lifestyles sort of ties in with that.
Cosmetics, too. I think cosmetic dentistry doesn't always have to be involving implants, and it can involve teeth and doing things correctly. And I think both of us have a tremendous amount of experience doing that as well. So, really anything that we can do, just come on in and we'll take a look. And if something that we don't provide, which is not very much, then we would refer you to one of our colleagues who can definitely provide the services for you.
What I like, too, you're talking about bone grafts earlier. See, I'm getting the jargon down now. But apparently you can do a bone graft on somebody using their own material.
Yeah.
That's pretty exciting.
Yeah, we can use your own bone. We can use bone that will trick your body to replacing it with your own bone. There's lots of things that we can do. And using the technology and using, like I said, using some of your own cells, and it really, really helps quite a bit.
And I know that in the earlier days, people would get the bone replacement either from a cadaver or from some animal, and there were some segments of the people out there that don't want that at all. So you make it easy for people.
Oh, yeah, absolutely.
Yeah, it's one of those things. It's still being used extensively throughout the world. This is not new, and it's certainly not going away quickly. The leading edge stuff that we're doing is utilizing actually your own products, your own blood products, to help regenerate tissues. And it's less expensive when we do it that way, and it's a better end result and more predictable.
And I think whatever, we're going to always give you the options of what we could use. We also give you the idea of what we think will work best. And most people want what's going to work best for them, and a lot, unless they have an aversion to one or two of the modalities. But otherwise, yeah, and we want to make sure that you have the best informed decision to make.
Yeah, I want to make one point. We have a lot of people who do come in and say, my doctor said I don't have enough bone for implants. Therefore, I can't go that route, and I have to be settling with a denture. We're here to tell you that in almost all situations, with some exceptions, but rare exceptions, that is not necessarily the case. And we can rehabilitate. Sometimes we can use that small amount of bone to give you solutions, and sometimes we can rebuild the bone and definitely give you solutions.
Yeah, it's rare that we can't use it to put have a patient get an implant. It's rare. It's very rare.
How long does an implant last? Is there a lifespan on that?
You know what? I'll tell you what I tell my patients every day. I say if it goes in stable and there's lots of bone around it, and the restoration or the portion on top of it's done well, and then you keep things clean and things are maintained, when you go to see the dentist or the hygienist, and things are maintained well throughout your lifetime, there's a great chance that the implant will outlast you.
Really?
And I always tell them there's a couple things that you can think about for an implant. You never get a cavity on an implant. Never need a root canal on an implant. So those are two big things for patients.
That's good news.
Right? And in honesty, it stimulates your bone to stick around the rest of your life, and that's the biggest benefit of it.
All right, I've been looking at your website and that sort of thing, and hey, I'm a novice. What do I know? But it seems to me like when you put an implant into somebody's mouth, do you put some sort of screw in there first, and then put the tooth on the screw?
Yeah, that's basically what it is. An implant is most times is a little titanium oxide screw we put in, or replaces the root of your tooth, and then it has an attachment on it that we put on either a tooth on it, or maybe another attachment for like a denture or a bar or something. But yeah, that's exactly how it could be described.
This would probably never happen, but let's suppose for some reason somebody broke an implant. Could you put a new implant on that screw?
Well, if an implant gets broken, we replace it. But replacing an implant is just as easy as I said. It's removing and replacing. It's not something that is an extensive thing unless something drastic happens.
Sure. So it's not like a big deal like it was years ago.
No, exactly.
Pretty cool.
Yeah.
Wow, Lifestyles is the name of the business. Make people happy. You make me happy every time I see you guys. You really do. Well, I got to come down for a visit and try some more of that nitrous oxide. I told you I went to my dentist, and I said, "Do you have any nitrous oxide?" And he says, "Well, you're not afraid of the dentist." I said, "No." I said, "I just wanted to try it." and now I've been asking every dentist I run into if you have like little canisters I could put under the seat of the front car just in case. Guys, thanks for coming by today. It's always a pleasure to see you.
Absolutely, same to you.
Congratulations on the birth of your new son.
Thank you so much.
Enjoy him.
I will try my very best.
Because pretty soon he could have his hands in your mouth.
I know. It already happens.
And I hope you have a wonderful birthday with your wife, Ron.
Thank you, Tom.
Thank you for coming by. Dr. Ron Zokol and Dr. Bobby Birdie, and they are the gentlemen responsible for the BC Perio Dental Health and Implant Center. Their address in Vancouver, 501-777 West Broadway at Willow Street. Telephone number is 604-872-0222. In Coquitlam, it's 250 1175 Johnson Street at Glen Drive in Coquitlam. And the phone number in Coquitlam, 604-936-8244. They can give you a call Monday, make an appointment, come down and see you, right? All right. Let's go home. Have a weekend, you guys.
Absolutely.
Thanks for being with us. It's Boomer Life on CL 650. It's Tom Lucas, and I'll talk to you Monday afternoon at 2 with more of your all-time favorites.